This lighted red. Good evening, all. Once again, welcome to Lighted Red podcast series, a joint initiative by Natco and Voice of Healthcare team. This Lighted Red podcast is a platform dedicated to spreading awareness, sharing stories, and bringing hope to everyone who has been impacted with blood cancer. You all know every year millions of people around the world are diagnosed with conditions like leukemia, lymphoma, and myeloma. Yet too often, signs and symptoms are ignored. But today we have Dr. Prakash Singh Shekhawat, a renowned and most experienced hematologist and BMT physician from Bhagwan Mahaveer Cancer Center, Jaipur, to understand and explore what actually blood cancer means. And also, he shares his knowledge on diagnosis, treatment, blood cancer as we explore how the multidisciplinary care is evolving in treating or shaping in the future of blood cancer therapy. Welcome, sir. It is always honored to welcome to this Lighted Red platform, sir. Welcome you, sir.
Thank you, Sundeep, and thank you for this program. And I would like to say thanks for this introduction. I am not the senior most. There are quite a few who are more senior to me. But definitely we are doing our part, and the Natco is doing a great work in helping our patients, providing good quality drugs, and creating these awareness sessions also for blood cancer. So our society, especially patients and the relative, they need to understand a lot of things regarding blood cancers.
Okay, sir. But your expertise, putting your our mind into your expertise, sir. So definitely will success this podcast platform series, sir. Okay, sir. Coming to when we talk about basic things, sir, what actually the blood cancer means and how does it differ from other types of cancers?
So, Sandeep, any cancer means uncontrolled growth of a particular type of cell in your body. All cells are destined to grow and they are supposed to die when their purpose is over. But when a cell evades this death, they gets accumulated more and more, or when they are produced, particular cell is produced more. So it's a collection of abnormal cells. It can be of any organ in our body, any cell type. Blood cancer is different from solid cancers in quite a few things. That blood cancer is always a systemic disease. Blood flows throughout our body. So a bone cancer can be limited to particular bone, or a breast cancer to a particular site. Blood usually spreads in our body, and because it affects multiple organs, so sign and symptom of blood cancer can affect or manifest as symptom of another organs also. A patient with blood disease may have chest pain. He may have mental fatigue and seizure also. So it's usually a spreadable disease. Second, compared to solid cancer, it is very aggressive and very much curable also.
Okay, sir. Okay, the difference has been explained very clearly, sir. But what are the main types of blood cancers, sir?
So the main type of blood cancers are leukemia, then there are lymphoma, then there are multiple myeloma, MDS cancers, different type of MPNs also. So leukemias are usually acute and chronic leukemia when the disease is in bone marrow and blood. It is spreading throughout your body. Second, for this lymphoma, the disease is mainly in lymph nodes. There are small glands in your neck, in your armpits, in your abdomen, groin. So these are lymphoma. Then there can be multiple myeloma. Multiple myeloma is like the cancer is a blood cancer, but it affects your kidney, it affects your bones, it affects your blood. So these are different types of cancer. So primarily leukemia, lymphoma, multiple myeloma, they are the main blood cancers.
Okay. Sir, is there any age standardization for this particular blood cancer? For example, this age, this is the type of cancer. This particular age, this type of cancer. Any age standardization is there, sir?
Mostly cancer can happen in any age, but if you go by like multiple myelomas or the chronic leukemias, they usually happen in the elderly in 50s and 60s, Whereas acute leukemia can happen across age group from 6 months, from 1 year, 2 year till 80, 90. So specifically, if you say acute leukemia, they usually come in younger age, and more so ALL is the commonest cancer. Forget blood cancer, it's the commonest cancer in pediatric age group. Likewise, CML cancer comes in the adolescent and adult bracket. Then MDS is a disease of late elderlies like 50s, 60s. So there are different types of cancer which classically falls in a different age bracket. Lymphoma can happen in any age group. They can come any age group. Chronic lymphoma is usually in the elderly bracket. Acute leukemia, any age group can be there.
Okay. Okay. When you talk about the burden, sir, or the incidence or the prevalence, what are the trends you've been observing in the incidence of this blood cancer, sir, in India?
So, Sandeep, this is a tough question. Actually, I will say the incidence of blood cancer has slightly increased. There are two reasons. One, because of better diagnostic facilities. Earlier, some of the cancers or some of the symptoms would have been missed. But nowadays, in the era of beautiful diagnostic facilities and advancement, the cancers are picked early. Then obviously the environmental factors have also a role to play. Now our internal and our external environment both are slightly favoring cancers compared to our previous eras. So definitely cancer has gone up and its diagnosis is more uh, easily available with better techniques. So the trend is upward.
Okay, the trend is upwards, sir. Okay. And what are the common causes of these blood cancers, sir? I mean to say, anything particular cause is there or any?
So there are common causes of any cancer, like one is your environmental factors, then your routine diet, then some of your genetic changes, then there can be viral infections also. Some of the viruses are prone to HIV can cause a blood cancer. HTLV is another virus which can cause blood cancer. Then the exposure to your radiation, pesticides in your food, in your vegetables. These pesticides are a notorious thing. They play an important role. They damage your body, they damage your cells. So, adulterated food is something. So, these are the things like your non hygienic food, not following a healthy lifestyle, pesticides, then exposure to radiations, chemicals like benzene. There are some cancers who particularly work in a particular chemical factory. They are prone to have cancers of urinary tract.
Okay.
Similarly, the viruses are there which can cause some sort of blood cancers, of which EBV and HTLV, HIV are common. So these are different risk factors. Then your genetic makeup is also there. Sometimes you may be carrying a gene from your family which can predispose you for a particular cancer.
Okay. Sir, you also talked about the environmental exposure, right, sir? Is this really affecting, sir? Environmental
Yes,
exposure?
yes, environmental exposure is a big thing and it really affects. The problem is it's not easy to measure and not easy to explain. With modernization and westernization, we are in an era we cannot avoid this environmental exposure. What we can do, we can try to maintain our internal milieu, try to
Okay.
regulate and control your internal environment with your habits and exercise and sleep cycle and food. External is not in much of our hand, but it affects, definitely it affects.
Okay. Then, sir, what early diagnosis is really essential for this blood cancer, sir?
Sandeep, early diagnosis is essential for any sort of disease. If you pick it early, the disease is limited. You give less number of chemotherapy, less number of cycles, less modality used. The side effect is minimum. Then the cost is minimum. The damage to tissue, healthy tissue, all are better. So if you pick a disease early, there is more and more chance of getting cured, so the person may live an absolutely normal life later on, and his or her organs are not compromised. But if you miss the diagnosis early, or if you don't visit your local expert or doctor, And when you come to us, the disease is full blown. A patient may be having metastatic disease, stage 4, high grade cancers, then their chances of survival decreases. So it's always good if you start early.
Okay. And sir, generally, which are the signs and symptoms which never be ignored in blood cancer?
So blood
Signs and
cancer
symptoms.
is because it affects blood, so it affects hemoglobin, it affects your WBC, it affects your platelet. So
Okay.
basically, if there is deficiency of your platelet, you may be having unusual bleeding or certain red spots in your skin or excessive periods. Girls may feel a heavy menstrual bleed. They can be bleeding from your tooth and gums and nose. These are for deficiency of platelet function. Then, if your hemoglobin is low, you may be feeling excessive tired. You may feel pale, white is
Oh,
unable to do work. And when your WBCs are compromised, you are likely to have repeated infections. So, a infection not healing properly, then there can be glands like lymph node in your neck or your near axilla and spleen enlarged in your abdomen. So, if there is an organomegaly, a patient may present to us with a big lump in neck, or he may have repeated infections. So, infections, there are multiple red spots in your skin, or a bleeding from your urinary tract, or menstruation, or gum epistaxis. These are early warning signs when you should not ignore.
okay. And sir, out of box, in because in some movies they show that hero will vomit blood vomiting. So it could be a sign of blood cancer, sir, for general audience to
Yes,
understand.
definitely. No, no, no. It could be a sign of cancer, but if someone is vomiting heavily, so he or she should be evaluated whether there is a problem with blood clotting or whether
Oh,
there is a problem with peptic ulcer. He may be having an ulcer in his stomach. It can be a
hmm.
sign of varices. Liver disorder can
Oh,
also present, like there are small vessels in our food pipe which ruptures, and it can be a hematemesis because of liver. So it is a danger sign. We used to say hematemesis means beginning of end of life. So one should not ignore this.
okay, sir. Okay, sir. So anyway, sir, we were talking about the diagnosis. So what are the general screening methods or diagnostic methods to detect blood cancers?
So it's relatively very easy compared to a solid cancer counterpart, because if most of the things will be seen in CBC. So CBC, a very simple test, 200 rupee, do it from a good lab. It gives you a very good picture that what is your different cell lines, lineages in WBC, differential, and then a good clinical examination about your spleen and liver, then your nodes. So it gives us a idea that the subject may be having some sort of blood cancer. So CBC and a good clinical examination, a USG abdomen is usually suffices to hint us that we are inching closer towards a cancer. Then to confirm a diagnosis, we may need bone marrow test or a biopsy, flow cytometry, multiple other tests also. But screening is relatively easy compared to other cancers.
Screening, okay, sir. And sir, when we talk about treatment and innovations, as putting your expertise into that, how was the treatment evolving if you compare from last decade, sir, in blood cancer?
So, Sandeep, like previously, cancer was a death sentence. So, someone has a cancer, the patient or their relative, they used to extremely frightened. Nowadays, the things have changed. Especially the one size fits all is gone. Something may be good for you, that may not be good for me, my genetic, my disease, my tolerance. So earlier, the blood cancer was predominantly treated by chemotherapy alone. Now we have moved away from chemotherapy in certain cases, and now the role of targeted therapy, immunotherapy is of paramount in certain cancers. There are many cancers who are completely curable if treated on time, and especially if we can add those good drugs, small molecules, then the targeted, they are immunotherapeutic drugs which are doing wonders in blood cancer. So from 30, 40 years back, it was only chemotherapy. Nowadays, it's a chemo immunotherapy combination. So earlier you were solo, now you are a couple having two different modalities to treat you. Then the role of radiotherapy, the role of bone marrow transplants, these are very important. CAR-T is another thing which has come big in blood cancer, and it is doing wonder compared to what we were doing for those extremely refractory cases. So definitely the treatment paradigm has changed a lot.
Sir, can you, for our audience, can you throw some light on CAR-T, sir?
CAR T cell, Sandeep, CAR T cell is a chimeric antigen receptor T cell therapy. It's a kind of, we call it actually living immunotherapy. Means it's a immunotherapy. We collect T cells, we collect lymphocytes from a patient's own blood. Then these lymphocytes are genetically modified with the help of a viral vector, and we train these lymphocytes against patient's own cancer cell. So we are taking your immune cell, we are training them to fight the cancer. Okay. So it's a kind of immunotherapy because it's a living cell and it lives in your body also for a certain period of time. It is a wonderful drug, wonderful, extremely beautiful response early on in most of the cases, but it's a costly affair. The price of CAR T in India is approximately, including most of the basic things, it ranges approximately to 35 lakh to 40 lakh, whereas the CAR T in Western world is approximately 3 CR. So 3 crore versus 40 lakh. So almost one ninth, one tenth cost India is giving CAR T to the population, those who need it. It's a very beautiful therapy.
Okay, sir. And sir, when does the patient should undergo bone marrow transplantation, sir? Is there
Bone
any
marrow transplant, bone marrow transplant is the holy grail of hematology. Most of the cancers which are refractory to a disease, a drug or immunotherapy, or when they comes back, relapse, then there are certain high risk cancers like AML, acute leukemia in elderly. Bone marrow transplant is usually done to cure those patients. The disease may again relapse after BMT also, but it is done in high risk acute leukemias, in all sorts of relapsed leukemias except APML, CR1, CR2. Then it is done for multiple myeloma, it is done for lymphoma. Then bone marrow transplant is also done for non-cancerous, like a patient of thalassemia. The baby is born and hemoglobin is not sufficient. The patient of aplastic anemia. There are certain immunodeficiency disorders. Since childhood, the patient has some immunity disorder. He or she is having multiple infections. So bone marrow transplant is a curative thing, not even for cancer. It is a very good curative thing for certain non-cancerous conditions also.
okay, sir. Anyway, sir, we are living in India, so always we have a question that you already explained what is CAR-T and what is the cost of the therapy. And when we come to affordability or accessibility, sir, how far these treatments are accessible and affordable to the patient, sir? Like
So
immunotherapy,
BMT,
whatever you.
bone marrow transplant is nowadays affordable to most of our patients because of government schemes. Everyone doesn't need CAR T, but BMT, many people needs bone marrow transplant, and because of the Prime Minister relief funds and the Ayushman and this in our Rajasthan, we are having a state government sponsored scheme which is beautifully running, and it helps a lot of patients. It gives almost near complete spectrum of coverage. Many of the blood cancers also. So the immunotherapies are a little bit costly, and some of those are not even covered in the package of government schemes. But chemotherapy mostly covered. Bone marrow transplant is covered in our state. CAR T not covered as of now. The cost is high, but the accessibility has improved. Many patients can take it. Then the TPA also covers it. So now things have changed in terms of affordability also.
Okay, sir. You also talked about accessibility, sir. But how far this accessible for, because you see the patients coming from Jaipur exteriors like Kota or something exterior villages, tier 2 or tier 3 cities. How far these treatments are accessible to those patients, sir? They should come down to Jaipur or.
Yes, as of now, unfortunately, we all need to come to Jaipur because many of the highly skilled and specialized things are still not accessible in Tier 3. To forget about, presently not available in Tier 3. Tier 2 cities in Jaipur is having almost everything. Jaipur is now, government can promote Jaipur as a medical hub, medical tourism. So Jaipur has almost everything. So many of the Tier 2 cities are also having these. Man and machine both are available in many of our tier 2 cities. Tier 3, it will still take some time to reach these high-end facilities to tier 3 because it needs a degree of what I say survivability also. These are very complex procedure and they need and they demand a lot of investment in financial aspect also to the one who is setting up those facilities.
Okay, sir. And sir, you already answered this question about government schemes. You were telling BMT is approved, BMT is included in some of the schemes. So this once again, I'm asking, sir, all the therapies are really government schemes are supporting, sir, central or as well as state.
Mostly for our blood cancers, immunotherapies are not supported by the scheme except for rituximab in B lymphoma. Bone marrow transplant, both autologous and allogeneic, are supported on a state government scheme. Central Ayushman supports autologous transplant. There are many allogenic transplants for thalassemia, which are supported by Coal India, if the donor is from family and a male sibling. Then Coal India also supports. Then there are many NGOs also. Central scheme supports autologous transplant and blood cancers. Immunotherapies are usually not supported as of now by government, but chemotherapies almost all are supported by government schemes.
Yes, sir. Even though this much therapy is evolved, treatment is evolved, but still that psychological impact will be there or psychosocial impact will be there on the patient. So how does you tackle those kind of patients who are emotional and who face psychological challenges? Because cancer itself is not related to one person; it affects entire family. So how does you counter those or counsel those kind of patients, sir, when they come to you?
So it's an individual approach, Sandeep. What I do after completing the staging, diagnosis, everything, I take a pen and paper, then I keep the patient and their near family members, decision makers, close relative, five, six people, and I ask them, please, those who are going to carry with the patient in every visit or frequently, please sit here and listen. If there is a problem in India, next time you will come with the patient, third time another attendant will come. Then every time if a new attendant comes, then it's a big trouble for us. And
Exactly.
because there is a fear of death, mostly people think cancer is a death sentence, so they fear a lot. Then there is this financial toxicity, fear of isolation in society and family. So you need a huge amount of psychosocial support. If we think like that, some of our patients in our initial counseling, they're very frightened, very anxious, in a sense of denial. Then I send them for a psychiatrist also and for psychological counseling also. We are trying, but we are not the best to so. So I sometimes ask my psychology team to see that patient and counsel them also. You need to give them a positive feed that yes, this disease is potentially curable or controllable. Don't fear this much. We can take care of this. We can sail through this. I will hold your hand, and these are the cost. How we can help you, the trust, NGOs, government. So if you explain all these are the issues which bothers a patient very much. Psychological disturbance is extremely common in our cancer patients.
Okay, sir, but still, sir, connecting to your uh, discussion, sir, is there still enough rehabilitation or survivorship programs in India, sir? What does you think, sir? Should we improve on that, or please, sir?
No, currently the survivorship and rehab programs in India are in, I will say, still in baby stage. It needs to improve a lot. There are many NGOs and survivorship programs to help them, but we all are not integrated and interconnected. I am sometimes doing different, they are doing different, someone else is doing different. So we need a better integration, and we shall help those, especially the adult and middle-aged bracket, to return so that they can return to their job, they can return to their work, kids can go to school. So the rehab program in India is still lacking.
Okay,
It's
sir.
far, far, far behind than our waste.
So, sir, it means creating more noise levels, conducting more awarenesses. We can achieve that also, sir, soon.
Definitely, we should make a noise and we should create awareness more and more so that people don't fear. Those who have survived, those who have been cured, they should also come forward and create awareness in society that yes, I have beaten a blood cancer, I am still alive. This was my cost and this is the journey. So everyone should help spread awareness in our society.
Okay, sir, what is the biggest myth you have heard from your patient that this ये हो सकता है ये नहीं हो सकता है सर ये क्या है what do you heard sir biggest myth generally a patient comes to you
So Sandeep, there are two, three things. One, when the patient is diagnosed with such a heavy disease, they think it is related to their bad karma or something. We tell them, ये आपका कोई खराब कर्म नहीं था. This was destined to. It is not in your hand. So don't be in a guilt trap that you have done some wrong, you have done some sin, so you are diagnosed with this first. Second,
अच्छा
the miscredit, or I will say the blame goes to our Bollywood and our TV when they have shown all cancers, mostly they die, and especially blood cancer have been portrayed in a scene that blood cancer is like, okay, patient mar jayega. That is not the scene. Okay. So because of Bollywood and television, people think blood cancer is very aggressive and patient will not survive. Second, for any sort of cancer, when we advise them to go for a biopsy, whenever an oncologist, surgical oncologist, they advise, okay, go for a biopsy. People in India still like to go away. They think if biopsy is done, the disease will spread. This is the biggest myth. Once diagnosed, if it's a curable, go ahead with your treatment plan, discuss with your patient. I tell the patient myself, yes, there are certain side effects of treatment. We know there are side effects of treatment. But if we don't treat, then the side effect is death. It is for sure. Okay. If you don't treat, the side effect is death. Side effect of disease, side effect of cancer is death. If you treat it with some medicine, immunotherapy, chemotherapy, there are high chances that you will be cured. There are chances that you will face some side effect, but then you can always overcome those side effects also. But if you don't treat, on the other hand, you are going to die.
yes sir rightly said sir my next question was that only what strong message and advice to the public who are listening to us but still in this question or answer only you have given that it is highly curable little side effects are there which can be manageable apart from this any strong and powerful message from your side in
So
this platform
I will tell my audience, please, whenever you are diagnosed with any disease, forget cancer. If it is a cancer, if it is a blood cancer, any sort of disease, um, don't be in a denial mode. Don't fear. Visit your nearest specialist or a tertiary center. Let them see, let them examine you and follow their advice. Almost never a doctor tries to ruin your life. We are connected to our patients. When my patient's condition deteriorates, my heart rate is increasing. Okay. So we always try to help our patients and their families. Don't delay a diagnosis. Don't overlook your symptoms. And many a time रिलेटिव ने बोला, रिश्तेदार ने बोला, दोस्तों ने बोला, कहीं पे myth, some sort of false information through social media. So these should not be done. You take the positive things. You trust your care team, your nursing, your doctors, your hospital, and follow their advices. If we are in a problem, there are situations when I don't feel comfortable, then I also ask for second opinions. Now, we are not here to ruin their life. Things are not in our hand. Don't
yes
be afraid of getting diagnosed with a disease. If you are, then get a proper consultation, proper treatment. Don't hesitate for second opinion. No issue. Discuss with your primary team. Sir, we are going there. We want a second opinion, but don't delay your biopsy and costly investigations, timely treatment. These will make your life easy.
yes sir right sir with this strong powerful message and advice we are at the end of our session we'll conclude the session sir Thank you very much, taking our audience and enlightening us through what actually blood cancer means, what are the treatments available, what are the innovations happened, and also when we should go to the doctor, a normal consultant physician, and also for all the things which you have explained for our audience. Thank you very much, sir, and also thanks for your valuable time. Thank you very much, sir.
Thank you, Sandeep. Thank you, Team Netco.
Thank you. And also thanks for technical team, Voice of Healthcare, who are supporting for us.
Sure.
Thank you very much, sir.
Thank you.
Sir, you can leave.
Okay.